This is known as a Jackson-Pratt or a JP drain. Some patients will go home with this. I'm going to show you how to care for this drain. You're going to be sent home with this paperwork. It's in detail instructions on how to use this drain if you want to take a look. We will have you empty this drain every 4 to 6 hours while the drain is still producing fluid. This is a normal colored product of the drain. It can be blood tinge or it can be tannish orange fluid. So to empty the drain, you unclip the top here. It will fill up with air and we'll pour it into this little cup that we will provide you. There are little numbers on the side of the drain to tell you how much output there was. This is about 30 cc's. We will have you track the output using this little chart here. This drain functions off a vacuum, so ensure that the bulb is tightly squeezed before you put the top back on. While you empty the drain, it's important to milk the drain, we call it. So hold the drain taut to the patient's body and squeeze down the line, and this helps prevent any clots from forming in the line. Thank you for watching our post-op videos. If you have any questions, our phone number here is 757-491-3535. Remember to stay hydrated.